our second invited speaker, Dr. Tulsi Giri Goswami. Dr. Tulsi Giri Goswami, ma'am, is working as an assistant professor, Department of Management, Central University, Rajasthan. She has 14 years teaching experience and author of 3 books. She has credited more than 20 research papers in national and international journals and presented paper in international and national conferences. She is a certified trainer of Indian Society for Training and Development, trainer IELTS and British Council of India. She is also the member of various academic and professional bodies. Welcome, Dr. Tulsi Giri, ma'am. Now it's over to you.
Thanks for the wonderful acquaintance, madam. I wish I'm audible to you all. Am I?
Yes, ma'am. Yes, ma'am.
Thank you. Namaskar, everyone. First of all, let me take the privilege to thank the Government Degree College, Gosai Kheda, Unnao, Uttar Pradesh, and Government Kaktiya PG College, Jagdalpur, for providing this opportunity to be a part of this webinar. So I welcome you all in the discussion about one of the ever-time prominent issue of the society, that is none other than domestic violence, of course. The term domestic violence is generally used to as an intimate partner violence, but it also encompasses the child and elder abuse and abuse by any member of household. While women alone don't face the domestic violence, the rate of violence and abuse directed at women are quite high, and particularly from wrongdoers known to them. They might be their intimate family members even. And according to the World Health Organization, 1 in every 3 women across the globe experience of physical or sexual violence in their lifetime. And at least 30% of all women in relationship have experienced physical or sexual violence by their partners in their lifetimes. The gender-based violence has never been strange to us and has been best identified with the isolation of the victim and exerting the physical, psychological, and at times financial control over them. As the ongoing pandemic epitomized the global isolation, it is no mystery that the rate of reported domestic violence and gender-based harassment cases has grown up drastically. And the domestic violence has often been studied as an abusive expression triggered by financial stress, mental stress, or fear, and of course the systematic patriarchy that has furthered the case of financial abuse and at times even murders. In the run-up to the announcement of nationwide lockdown, I believe in the month of starting March, the government failed to craft the strategies to address possible fallout in several areas, and one such area that went unaddressed was domestic violence. That was completely ignored while drafting the preparedness strategy during COVID. The national lockdown has reported more than 50% rise in domestic violence. The sense of isolation and financial and medical anxiety coming along with the deadly pandemic and sinking economy has increased the frequency of traitors within home and most certainly challenged the concept of escape from the victims. As we know that more than 1/3 of world's population was under the lockdown, the recent UN Women's Report, I believe that was entitled as COVID-19 and Ending Violence Against Women and Girls, has reported that since the outbreak of COVID-19, the violence against women and particularly the domestic violence has increased in several countries as security, health, and financial worries create the tension and strain accentuated by the cramped and confined living conditions under the lockdown. So billions of people were now sheltering at home from the global impact of this COVID-19. In many scenarios, the abusers have been found to spread the misconception around the pandemic in the attempt to contain the victim at home itself and threaten to not provide financial support even the victim is dependent on them. not pay medical attention if the victim needs so, and abuse alcohol and drugs as an excuse to cope with the ongoing stress. And the number of crime against women has always been underreported, even during the time of deadly pandemics. I believe you all can recall that moment most popularly, that the campaign was Me Too campaign. In spite of being one of the most powerful initiatives taken by the feminist movement in India, had seen many pitfalls, bringing the abusers down at times. Receiving all the complaints and cases of harassment against women in India, while our culture confused with the patriarchal fear, had certainly kept many women away from raising their voices. Let's also look at how has it affected the system dealing with harassment in India as well. The policies addressing the safety of women we have already had in place, but we had only limited impact of those. While most of the reformation are underdeveloped, and there are several issues like microaggressions and even marital rapes that don't even have a separate provision to be dealt with. Even though the Protection of Women from Domestic Violence Act has reached out to some of the women, but has largely been flown with an exhaustive procedures and not uniform protocol for service providers that the victim have to go through with that. And due to this lack of seriousness, little focus has been provided to most of the systematic measures related to gender-based discrimination in India. And in order to work out around this, the detailed funds, exclusively attention, and a more advanced strategy is definitely needed. And while the verbal advocacy of violence against women has often been used as a steady jargon, the ineffective political initiatives on the ground increases the internalized discrimination against women all the time. The consequences-based model of most of the systematic measures against harassment, another loophole explaining the underreported cases of women harassment. Our policies essentially follow a black and white mechanical approach to deal with something as sensitive and traumatic as harassment. The state would either prove the person innocent or provide negative consequences to the guilty. Many negative consequences, particularly like capital punishment, merely assert an idea of state solving a problem without actually ending the problem, and without understanding what lead to similar oppressive causes around the year. A last minute short-term fix like punishing the culprit, further sensitizing the issues and causes immense discomfort to the victim. And especially the abuser is close to them. A complaint lodged by a victim against their family members definitely negatively impact their family dynamics and may lead to increase the chances of harassment furthermore. And moreover, the fear of victim blaming, especially in case of against family members, is always lurking around. And instead of focusing on deciding the number of consequences for the culprit, our policies should be more victim-centered, what I believe so. And they should spend more time talking to and understanding the victim and creating an unbiased, easy, practical, and recurring system of support and safety that all the victims can keep reaching out without the fear of things getting complex with their further abusers. And leaders in these systems should have more sensitive, multidimensional, problem-solving approach so that the victim can feel heard and supported instead of finding themselves overcome in another battle. Anyone is capable of being an abuser, and definitely anyone is capable of being victim as well. So gender-based violence is a systematic problem that needs to be understood holistically to drive an accurate solution. While the more overlooked aspects are still in question, like Delhi Commission for Women has set up a helpline number also to combat the violence and trauma during this pandemic, and the one may reach out until we hope to see the problem being completely dismantled one day. And according to another report of, I believe that UN has given this report, the economic impact of COVID-19 resulting from the widespread closures of business and industries has put an increased financial strain on communities, particularly in segment of people that are already vulnerable. Women's disproportionately work in an insecure, a low paid, a part-time and informal sectors with little, or I can say no, income security and social protection. So a loss of income for them in abusive situation make it harder for them to escape from them. And in India also, the lockdown is having not only a similar effect, but also perhaps more acute fallout, I believe so. The National Commission for Women, which received the complaints over the domestic violence from across the country, has recorded a more than twofold rise in the gender-based violence in national lockdown period. And the total complaints from women rose from almost doubled during this a short-term lockdown period. And increased abuse is a pattern of repeated in many emergencies, be it conflict or economic crisis or even during disease outbreaks. So however, the quarantine rules pose a particularly grave challenge for those women. Being confined to the home because of lockdown is difficult for everyone, but it becomes a real nightmare for the female victims of gender-based violence. As the COVID-19 pandemic continues, the number of likely to grow the multiple impact on women well-being, their sexual and reproductive health, mental health, and their ability to participate in the recovery of society and the economy. Mental health, the activities feel that definitely they are going to see explosive increase in the number of reports of domestic abuses once the lockdown restrictions are eased or even it's completely vanished. And this has been recorded by almost all the state women's commissions nowadays immediately after this third lockdown ending. And the main reason for this rise of domestic violence is that men at home are taking out their frustration on women. And moreover, much of the domestic labor still gets to be done by the female only, as men refuse to participate in the domestic care works, and the job loss, salary cuts, and uncertain future arising out of lockdown has everyone on the edge. And it's not confined to the lower classes only, but also invades the middle and upper middle classes where men and women both are working, because they see their self-esteem being crushed every day. So women confined within the four walls, and those houses cannot share their grief with anybody. Likewise, the children are not able to attend the schools, so which aids the problem as there are no outlet for them outside. And the victim are also scared of complaining to the police because they fear that the harassment definitely will gonna increase. And in addition to physical violence, the common tool of abuse include isolation from their friends, their families, and even employment. The constant surveillance is strict on them, and detailed rule for behaviors and restrictions on access of basic necessities even in home. The isolation has also shattered the support network, making it far more difficult for the victims to get help or escape from a threatening environment. An important reason for this is that where victim previously found space for the breathe, whether at work or at socially, they are now spending all their times at the home with their abusers. And that's quite pathetic for them. Not only in India, but the government all over the world, as the UN report shows, are receiving more and more calls for help as victims of the domestic violence fear for their own and for their children's health and well-being. The increased threat to women and children, in fact, is a predictable side effect of this COVID lockdown, I believe. And the current circumstances make reporting harder, including limitations on women's access to phone or helplines and disrupted public services like police or approaching for justice or even for social services. And these disruptions may also be compromising the care and support that survivors need, like clinical management of violence, mental health, social psychological support. And in ordinary times, the women can approach freely counseling and using these online facilities for reporting the crimes, and also approach a neighbor, or they can also approach any of their friends or relative, or for shelters identified to go in case they need to leave the house or home immediately for the security or safety purposes. But that has been too difficult during that lockdown period. And however, as the lockdown and limited movement outside the home appear to be long drawn affair, the best resources for victim of physical abuse is to report the crime and seek help. It is critical, therefore, to prioritize the need of women through the efforts of the government as well as civil society organizations, and also the concerned agencies like some of the NGOs are working for them. It is therefore essential to be fully fortified to be able to respond to the increased demand for the help for those sufferer women. So, and according to the crime report in India, I believe it was a report of 2018 that was published by National Crime Research Bureau, a crime recorded against women in India every 1.7 minutes, and a woman is subjected to domestic violence every 4.4 minutes. It also topped all the categories of violences against women according to that report. And that's quite I believe it's a thought-warming process for all of us. And the National Family Health Survey that was conducted in 2015-16 has also highlighted that 30% of women in India between the age of 15 to 49 years have experienced physical violence. And the report suggests that among married women experiencing physical, sexual, or emotional abuses, an alarming that was 83% list her that their husbands as the main culprit, followed by abuse from their husband's mother or their fathers or even family members or other siblings. So these statistics don't capture the data on violence against women in its entirety. This is primarily due to prevalence of orthodox social norms and the stigma that placed on survivors of sexual or domestic violence, which result in cases being grossly underreported. And women also feel unsafe while approaching the police because they worry that if their partner are arrested, definitely they may face worse abuse once they get released from those. And in the interim, they might face the harassment from their in-laws as well. So there is no doubt that the mandatory stay-at-home rule during this COVID and social distancing and economic uncertainties and also the anxiety caused by the pandemic, this has increased globally. And India, and famous for gender-based violence, and I believe it's ranked the 4th worst country for the gender equality according to the public perception. It's showing the similar trend. So the number of cases reported are the most likely not proportional to the actual rise in the domestic violence. This is because people locked in with their abusers and may not be able to get access of any of these approaches to file a complaint. And most avenues seek help to the physically remove themselves from the situations are impaired. And being trapped in the space with violent or manipulative individuals could lead to increase the rate and intensity of threats or their physical harms, sexual or psychological abuses, humiliation, intimidation, or even pressurizing their behaviors. And the ability to isolate a person from family or friends, or monitoring their movements or even restricting them to access for financial resources or employment opportunities, and even education or medical care is heightened by this lockdown period. And this behavior often have lasting effect on people and can significantly affect their mental life and well-being forever. And so we just need to give a view that how could we been handle this, or what can have we done, or what we can do for future aspect. So when governments start putting together all the plan to respond to crisis such as COVID pandemic, addressing the domestic violence should be on the priority list of the government. I believe in India, the government seems to have overlooked the need of formality, integrating the domestic violence and mental health repercussions into the public health preparedness and emergency responses planning during this COVID pandemic. And we need an aggressive nationwide campaign to promote the awareness about domestic violence and highlight the various modes through which complaint can be filed. A national news channels, radio channels, even social media platform must be strategically used, similarly to the way in which government has deployed the campaign like advocating the physical distancing, and also there was a campaign for hand washing comment in COVID-19. So reaching out to the people facing domestic violence, a distress need to be classified as an essential service by the government. Citizens must be sensitized towards the increased risk of domestic violence, and bystanders and neighbors should be urged to intervene if they suspect any kind of domestic violence, and using tactics such as banging the doors, or even they can give the ringing to the bell of their neighbors. And they should also be provided the benefit of anonymity if they choose to report the cases. And when people are unable to file the complaint through the messages or through the post or any calls, the essential services such as hospitals, grocery stores, medical stores, or even pharmacies must be urged to help people to get the necessary support and send their messages to the authorities if needed. And the best example we can see for these type of assistance or help is like in France or in Spain, the pharmacies are being trained to identify people facing abuse through the code words, and like asking the code word mask 19. This was a code word used by those people, is being for the people who cannot speak openly that I'm suffering with the domestic violence. So they may use this code word to indicate that they are being abused and seeking for help. And civil society organizations are critical to provide such assistance. And hundreds of non-profit organizations are also working for that. And medical assistance like legal aids, counseling, and round-the-clock 24/7 shelter homes are also needed for that. Therefore, it is an effort to combat the COVID-19. The government should allow the civil society and organizations and NGOs and even the counselors and mental health working organizations to reach out and to help them people for facing the domestic violence. And reaching out the people facing domestic violence and in distress need to be classified as the essential service by the government, and it should be mandatorily classified as the essential service. And healthcare facilities should also be updated, the referral pathways of services available locally to include information on psychosocial supports and counseling services for protection services and hotline shelters. The healthcare providers need to be aware the risk of increased domestic violence against women during this time. And also when survivors reach out for the health facility, they can receive the appropriate and compassionate healthcare over there. And providers can help survivor by offering a first line support and relevant medical treatments. And humanitarian responses organizations also need to include in the services for women subjected to violence and the children in the COVID pandemic responses plan, and gather the data to report the cases violence against women, because they themselves might not are comfortable to report their cases. So this can be done. And the effect of violence are very often long-lived. And violence in all its form can have an impact on women's well-being throughout the rest of her entire life. This is unacceptable, and the risk of violence that women and the children facing during this scenario. When we able to prevent the violence or to support the women survivor of violence, we help to safeguard the women human rights and promote the physical and mental health well-being for the women throughout their lives. And this also helps to elevate the pressure on already stressed essential public services. which include the health system as well. And if you know that, or you concern about, or someone in any abusive relationship, there are something what we all can do is like keeping regularly in touch with those people to check that they are safe and ensuring it is safe for them to be in touch with you, assuming that the abuser of violence can see and hear, or even they can monitor your communication with the chat. So find out how best to communicate with the person that you are concerned about, and send them, you can send them messages, or you can use any of the social networking site, but be discreet in connecting with them when abuser is present in the home, so that they are not placed at risk in additional harm just because of that you are intended to help them, and they might be suffering because of you also. So find out what services for survivor of violence against women are functioning during this scenario, and how you can keep the data and record of all those, and you can provide as and when these informations are needed for the sufferer one. And if someone you know need urgent help for the whatever region, be prepared to call the emergency lines, health services, even the police. You should not forget about that also. So violence against women remain a major threat to global public health and women during this emergency. So let's see how this can exacerbate the risk of violence for women, like stress, the depression, the disruption of the social and protective network, the decreased access by them to the services can all exacerbate the risk of violence for women. As distancing measures are put in place and people are encouraged to stay at home, the risk of intimate partners violence are likely to be increased, that we already have discussed a lot, that definitely because of this pressure they might are suffering. Women bear the brunt of increased care work during this pandemic, and even schools are closed. We all are know, because most among we are having the kids, and school going kids are also there. So school closures further exacerbate this burden and place more stress on them. This disruption of livelihood and ability to earn the living, including women, will decrease the access of basic needs and services, increasing stress on families, with the potential exacerbate conflicts and violence. As resources become scarce, women may be at a greater risk for experiencing the economic abuse. And abusers may use the restrictions due to COVID-19 to exercise power and control over their partners to further reduce the access of services. Even the access to vital sexual and reproductive health services, including for women subjected to violence. So the risk of violence that women and their children are facing during COVID-19 can never be ignored, not at our personal level, not at regional level, even not at the central or government level. So health system are the important, or we can say the health system are the crucial part to tackle these situations. So ensuring the services for women who have experienced violence remain accessible during COVID-19 outbreak. Although the COVID has placed immense burden on the health system, but the health workers are caring for the sick. There are things that can help mitigate the impact of violence on women and children during this time. The government and policymakers must include the essential services to address the violence against women preparedness and also respond for this scenario. They need to arrange a special fund for them and identify the way to make them accessible in context of physical distancing measures. And health facilities should identify and provide the information about the services available for the sufferers. And health providers also need to be aware of the risk and health consequences of violence against women. They can help women who disclose by offering first-line support and medical treatment. The first-line support include like listening empathetically without any judgment, or inquiring about the needs or concern they are expecting from you, and validating the survivor's experience and feeling, enhancing their safety, and connecting survivors to the required support service which they are expecting. And the use of mobile health kind of things, or like telemedicine kind of things, can also be safely addressing violence against women, must be urgently explored by the system. And humanitarian responses organization also need to be included in the service system. Community members should also be made aware of the increased risk of violence against women during this pandemic, the need to keep in touch with the support of women subjected to violence, and to have information about where help for survivors is available. And it is important to ensure that it is safe to connect with the women when abuser is present at home. That will be safe for you as well as for the sufferer. And strengthening the advocacy and engagement of a different actors to address the violence against women during this pandemic is also needed, like building a strong advocacy and awareness about the increased violence against women, and engaging the media outlets to continue to raise the visibility of increased violence against women, and demonstrating how the risk factors that drive violence exacerbate the context of pandemic, and sensitize and engage the private sector using available global guidelines which are provided by the WHO as well, that how to prevent and respond to violence against women and girls, including female employees who work from home during this COVID pandemic. And some other recommendations we can talk about, like treating the services for women who experience the violence are as essential services for the system, and strengthening the services through the capacity rapid assessment, through design of risk assessment, and also safety planning, case management, also adapted the crisis context to ensure the survivors access to support all these things, and ensure the psychosocial support that is definitely required. It's not only about the physical harassment, the more cases are of psychological and mental, and because these are even more unreported as compared to physical. It's physical is quite visible, but these cannot be visibly seen by the system. So these are the cases where women suffer a lot. So ensuring the social psychological support for women who experience violence, and frontline health and social support workers to be included in this, and strengthening the helpline, including through the protection from sexual exploitation or abuse, or online counseling, or technological based solutions to be developed and provided or continued by the government, and training the first respondents on social psychological support, including health workers, law enforcement, and court officials as well, in emergency shelters or counseling staff to be included and to be prepared for that, and ensuring the women's organization, women's community organization to participate in the decision making processes, so that the needs and concern are identified and included in the prevention of responses to the violence against women, the strategies to be designed and developed by the government with consultation with the women organizations which are working on the working on the violence issues, and considering the role of women organization and recovery plan as well, and also collecting the 6 disaggregated data on the incidence of violence against women, and including domestic violence as sexual violence, and recording all the places of occurrence. So it is critical to address the increase in violence against women during this pandemic. We all have seen, and if we all have not faced this, but definitely we have seen in news and in articles and in researches, we have seen all these data. So finally, what we can say by the end, that given the above discussion, we wish to emphasize the seriousness of this pandemic in the world, and need to be spare no effort to reduce the speed of this coronavirus transmission at the population level, and reduce the incidence of disease, especially the severe cases. Besides the evidence, we can emphasize the need for specific measures to deal with the violence against women. And given the perceived increase in the domestic violence during this pandemic, institutions and social organizations have developed the material and on the prevention of violence during the social distancing. So all these documentation and research based guidelines has been prepared by these bodies, like WHO also has prepared some of the guidelines. Even UNICEF has also prepared. The Center for Disease Control Prevention also has prepared. So these to be shared with public at large, and these to be, I believe, for implementing all these guidelines in our country, these must be converted into regional language, so that these can be easily understandable by the people who actually need this. Because the major concern for our government, what I feel is that we have all the strong documents, we have all the strong legislations even, but every document is recorded in the international language, and people who deadly need these, they are not getting benefit out of these just because of this language barrier. So these must be converted into regional language, so that these can be provided to the people whosoever need these. And finally, I hope that this talk has shone the light on the problem and can sensitize our groups, and even we can also recommend for the government officials and the society workers or the concerned who are working related to this issue as a whole, to incorporate these strategies what we have discussed into the set of interventions and aimed at harm control and reduction during this pandemic. So I believe that was a purposeful talk. Thanks from my side. Now over to the organizers. Thank you.
Thank you so much, ma'am, for this wonderful session. Now, I would like, I'll take some questions asked by the audience.
Yes, sure.
Yes, ma'am. Yes, ma'am. Ma'am, there is a question from Ankit Maurya and Sukhvinder Kaur. What step could be taken to curb the domestic violence?
See, the steps what we can take, as I already have discussed, that rather than saying everything to be designed and strategized by the government only, the first step we can take by ourselves. Means if we came across any person or any female who is suffering with this domestic violence, so at our own personal level we need to take a stand. So if one person will take a stand, definitely will convey this to other, and this kind of message will spread throughout the society. Means we can give the first attention to the sufferer, we can give full attention, we can listen their problems, we can try to help at our own level, and even without even getting informed to their family, we can just intervene. If we are facing that they are suffering, we can just interrupt by ringing the doorbell even, so they can stop this. If violence is going on in the home, they can stop that, and in between we can enter into their home. And even if they require some help, or even they require to escape from that threatening situation, we do need to help them out, to bring them out to that situation. Even we can call them at our home, and if the situation is more serious, then we can approach to the service providing bodies, like even we can call to the emergency helplines, emergency health providers we can approach. And even the scenario is more crucial, then we can also call the emergency police line as well. So what I personally believe is the first step to be taken by ours, if we are coming across with these type of people, so we can give at least a mental support, we can give a psychological support. Definitely if there is any health issue or physical issue, we might not be in position to give the help, but the first help required for the position the person is definitely a mental support or psychological support. That definitely we all can do. I believe yes, I have answered that.
Yes, ma'am. Another question from Vijay Kumar. Why suicidal tendency is increasing in the society during this lockdown period?
See, all these regions we already have discussed, that a female cannot go out. And the farmost reason is that male are also staying at home, and because they are losing their income, some among them are losing their jobs also, So they are getting frustrated because of this economic crisis, and they can't even go out to exert their stress. So they are busting and vomiting out their stress and anger over the female only. So this is the basic reason, that because they are facing the economic crisis and they are not being able to fulfill the family requirement, and some of the families are also suffering with the basic necessities. So because of this, they are also, means it's not only the fault of only male, the fault because of this economic crisis. They are feeling under stress, and just to bust out their anger, they are using female and they are abusing them. This is the basic reason what I have found.
One more question, ma'am. What are the provisions for the domestic violence against men?
That is deadly needed and quite.
Scenario same for men and female, ma'am.
Yes, of course. That what I said, that domestic violence doesn't mean the only female. Why we are talking about the female? Because these are the more recorded cases, and females suffer comparatively more abuse as the males. That's why definitely
somehow men also suffer.
Of course, I do agree. Male also face the domestic violence, but the only loophole is that they don't have any specific law or any specific organization yet formulated where they can approach directly for them. So I must say that as we are living in a patriarchal society, so men can handle. That's why they are saying that they are doing all these things and female are suffering. So men can take initiative by themselves to make the female understand that, okay, if whenever or whensoever I have abused, and replication of that, if they are getting abused, so they can go in consultation and they can go for the mutual settlement only.
Yes, ma'am. Thank you, ma'am. I hope the participants has got the answer.
I wish so.
Yes, ma'am. I have some question from Sushma Singh, ma'am, too. Now, Sushma Singh, ma'am. Ma'am is on it.
Sushma, ma'am. She is here.
Can I ask?
Yeah. Sushma, ma'am, are you there? I think, yeah. She is here.
Can I ask?
Sushma, ma'am, are you there? Move ahead.
Okay. Ma'am is there?
हेलो सोहेब, मैम की आवाज नहीं आ रही है. मैम लाइव हैं.
Okay. Ma'am is there?
हेलो सोहेब, मैम.
Ma'am, I'm asking this question from you. Hello, Tulsi ma'am.
Yes, please.
Yes, ma'am. The question is, इस लॉकडाउन पीरियड में महिलाओं के स्ट्रेस को कम करने के लिए महिला आयोग द्वारा जो क्या भूमिका है या क्या स्टेप्स लिया गया है, ये जानकारी चाहते हमारे participant.
Okay, I believe that specifically related to the measures taken by the Women Commission, that better to be answered by Madam Sushma only, because she is from that strategy.
आपको आवाज
Right? I may not be in position to
actually,
give the exact
actually,
measures taken by
there's some
the
problem.
Women Commission.
Yes, ma'am. She could better explain.
Yeah, she could better explain, because she is from
Yes,
the
ma'am.
Women Commission. So the strategies they have
Right,
designed and
ma'am.
they have
Right,
implemented.
ma'am. So I'm moving ahead. Okay.
Can you hear me? आपको आवाज आ रही है?
Oh, Sushma ma'am. Yes, ma'am.
आवाज आ रही है?
Yes, ma'am. आपकी आवाज आ रही है, मैम. मैं
जी,
आपसे क्वेश्चंस पार्टिसिपेंट्स की तरफ से आपके लिए कुछ क्वेश्चंस हैं. एक क्वेश्चन आया है राजीव कुमार पानीग्रही की तरफ से. इस लॉकडाउन पीरियड में महिलाओं के बीच बढ़ते स्ट्रेस को कंट्रोल करने के लिए महिला आयोग द्वारा क्या स्टेप्स लिया गया है या कोई योजना बनाई गई है?
देखिए, स्ट्रेस को कंट्रोल करने का काम महिला आयोग नहीं करती है. पहली बात, क्वेश्चन का भाव कुछ और होगा, पूछने का जो तरीका है वो
स्ट्रेस
कुछ और
मैनेजमेंट रिलेटेड मैम.
मैं वही बता रही हूँ आपको. महिला आयोग के हस्तक्षेप करने के जो कारण हैं, उन्हीं में महिला आयोग हस्तक्षेप कर सकती है. क्योंकि लॉकडाउन के पीरियड के दौरान आप जो सामूहिक लोगों का इकट्ठा होने पे रोक लगी हुई थी सरकार के द्वारा भी, और सोशल डिस्टेंसिंग को फॉलो करने के माध्यम भी, इसीलिए कोई ऐसा मैनेजमेंट नहीं बनाया गया है.
नॉट ऑडिबल मैम.
If it's not specifically related to Women's Commission, in general, I can answer this question related to stress management. Say how to tackle the stress.
Yeah, ma'am. Continue.
Okay. Shall I?
Yeah.
Ma'am,
Okay.
please carry on.
See, stress management means that people are facing this. Why we are correlating this with the COVID? Because all are staying at home and all are suffering with this. But specifically, that measures taken by commission, they might have different strategies. But in general, what I can suggest is the first and foremost thing is we, be it a male or a female, even a child, irrespective of any gender or race, we must consider our individual dignity. The first and foremost thing is we must consider that we have our own individual dignity, and with that individual dignity, we need to keep our attitude positive. The positivity in our attitude towards us, towards our life is first and foremost thing. No one else in coming to you and will say, no, you just need to take a rest, you are gonna tired and you are suffering with all these things, so take rest. We need not to expect these things from anyone else. It's our own life, it's our own dignity, so we have to keep our attitude positive for that. And we just need to accept the universal realities what are going in the scenario, that we are the part of this. In any hurdles if we are facing, definitely because we are the part of this system, that's why we are facing. So we must be assertive towards the scenario rather than being aggressive towards that. We must have a positive attitude and we must learn the practices to get relaxed at home. We must need to practice the exercises regularly so that we can get relaxed, our body can get relaxed, and definitely our mind get relaxed. And we can give this positive attitude to our family members as well. So this is
Thank
a
you so
prime
much, ma'am.
thing I need to stress buster.
Yes, ma'am.
Thank you.
Thank you so much, ma'am. This is very, very important and very valuable talk with you. Now, moving ahead, I would like